Today we will be discussing about the topic stroke. Mainly I will be discussing about the ischemic stroke. So as you know, there are two different types of stroke, ischemic and hemorrhagic. Ischemic is like when there is no blood supply, brain tissue gets damaged. So before understanding the stroke, so we have to be familiar with the different names of the arteries and the regions of the brain. So here you can see in this diagram there is anterior cerebral artery, middle cerebral artery, posterior cerebral artery, and internal carotid artery and vertebral artery. These vertebral arteries are the two arteries coming backside of your neck, and these two will be joining to form the basilar artery, and this will continue, and this bifurcates into posterior cerebral artery on both sides. And this internal carotid arteries which comes from the neck, they will continue as the middle cerebral artery, and this anterior, middle and the posterior are joined by the communicating arteries. This is the anterior communicating artery and this is the posterior communicating artery. So this will form the circle which is called as circle of Willis. So now we move on to the vascular territories. So suppose this is a CT scan which you normally see in the ER department, and here these are the territories. Okay, the blue color is the first we will see the anterior cerebral artery. So from top to the bottom, this orange color, this is the anterior cerebral artery territory. This anterior cerebral artery will be supplying this part of the brain, and the posterior is in the posterior part, and the middle is the blue one. So we have to be familiar with this diagram. I'll be explaining. Yeah, see, I'm taking this part of the brain here, and you can see there are different names here like genital, toes, foot, leg, hip, trunk, neck, head, shoulder, arm. So these are all the regions in the brain that will be responsible for the action of these organs. It may be sensory. So here we'll start from here, from foot, and it goes to shoulder, arm, and then this is the hand, and here eye, nose, face, lips, teeth, gums, jaw, tongue, and pharynx. So why it is very important is like, suppose I say there is a loss of blood supply in this area. So what will be there will be neurological deficit in foot, toes, and genitals. Suppose if there is a decrease in blood supply in this area, so maybe the motor loss will be in the hand. So you have to remember this diagram. So, and one more thing, just they have given a color coding. So ACI is the anterior cerebral artery, this area will be gone, and MCI is the middle cerebral artery, this part. And posterior circulation artery is like posterior part. And now we will discuss about the anterior circulation stroke. So anterior circulation stroke, mainly the anterior cerebral artery will be compromised. So there is a block in the anterior cerebral artery. So what are the symptoms of anterior circulation stroke? Is like there will be contralateral, the opposite side, motor weakness. So motor weakness will be there. Here the weakness in the leg and shoulder will be greater than arm, hand and face. Okay, remember this. So there will be a greater motor power loss in the leg and shoulder than arm, hand and face. And next one, there will be dysarthria. Dysarthria is like slurred speech. And aphasia. Aphasia is patient will be unable to talk. And this is the specific symptom in anterior circulation stroke, that is urinary incontinence. Okay, urinary incontinence. And second one is behavior and personality changes. Because so anterior circulation stroke means it will be supplying to the frontal lobe. Frontal lobe is mainly responsible for the behavior part, behavior and the personality change. Patient will be agitated. For example, patient will be fully agitated. Yeah. Yes. So this is the example of the anterior circulation stroke from top to bottom. Like you can see mainly the medial part of the brain, just just beside the midline you can see the infarct, and here this one and this one, right? Yeah, now we will move to the medial cerebral artery. Here there will be contralateral, same motor weakness, but it will be opposite to the anterior cerebral artery stroke, means face, arm and upper limb weakness will be more than lower limbs, and there will be expressive or receptive dysphasia. So what is expression receptive dysphasia? Dysphasia is like patient will be finding like patient know how to speak, but he will be finding difficulty to speak. Suppose he want to say some words, but he cannot formulate the sentence properly. So that is dysphasia. And next one is contralateral neglect. So what is neglect? Neglect is like, suppose there is a right hand arm and leg weakness. Whenever you stimulate the patient will not be, if you pinch the patient, even though there will be a sensory even though the patient sense the pain, but he won't be listening to you. Okay, so that is called ignoring the stimuli, right? And then this is the medial cerebral artery stroke, this part. So this was, see, this medial part was spared. So this one was the anterior part. Just now we have seen this is the middle part, right? Now we move on to the posterior circulation stroke. So posterior circulation stroke, which will be supplied by the posterior cerebral artery. So when this artery gets blocked, patient will be having blurring of vision, patient will be having ataxia, vertigo. This is the most common symptom in posterior circulation stroke. And this hints exam that we discussed earlier, hints will be positive. and patient will be having central vertigo symptoms. And one more thing, patient will be having contralateral homogeneous hemianopia. Contralateral homogeneous hemianopia is, these are the eyes, this is the vision, this part and this part, this left and right. So this visual field and this visual field will be lost, and this is the posterior circulation stroke. Now we move on to the medullary stroke. So in medullary stroke there will be lateral medullary stroke and medial medullary stroke. Lateral medullary stroke, which is also called as Wallenberg syndrome. So lateral medullary, so suppose this is medulla oblongata, lateral part will be gone. So mostly this area will be supplied by posterior inferior cerebellar artery. So posterior inferior cerebellar artery occlusion will be there in lateral medullary stroke, or which is also called Wallenberg syndrome. So mainly here a set of cranial nerves will be gone, like fifth cranial nerve, 8th, 9th and 10th. So fifth cranial nerve, facial nerve will be gone, so patient will be having facial numbness. And 8th cranial nerve, vestibulocochlear nerve, so this will cause vertigo or vomiting. And 9th and 10th, 9th, 10th and glossopharyngeal and vagus nerve, so patient will be having hoarseness, which is very important, hoarseness and dysphagia. So there will be difficulty in swallowing. And apart from that, patient, the sympathetic fibers will also don't work, so patient will be having Horner's syndrome. So Horner's syndrome is like patient will be having ptosis, meiosis and anhidrosis. Ptosis, meiosis, anhidrosis. And one more part, the spinothalamic tract will also get affected. Patient will be having contralateral pain and temperature loss. So what is lateral medullary stroke or Wallenberg syndrome is like, there will be involvement of 5th, 8th, 9th and 10th cranial nerves and the sympathetic fibers. 5th cranial nerve is gone, which is facial weakness or facial numbness. 8th, patient will be having vertigo, vomiting. And 9th and 10th, hoarseness and dysphagia. And sympathetic fibers, patient will be having Horner syndrome, which is ptosis, meiosis, anhidrosis. And sympathetic spinothalamic tract will also be gone. Patient will be having contralateral loss of pain and temperature. So this is the lateral medulla and lateral medullary stroke. And now we move on to the medial medullary stroke, where here there will be 12th cranial nerve will be gone, which is hypoglossal nerve. So what happens here? There will be deviation of tongue to the side of lesion. If the lesion is on left side, tongue will be deviated towards left side. And one more thing, the cortico spinal tract. Spinal tract will be lost, so there will be contralateral motor weakness like hemiparesis, motor weakness. So this is the medulla and this is the medial part has gone. And the last one, that is thalamic stroke. Thalamic stroke, whenever the patient is having thalamic stroke, number one is patient will be having decreased conscious levels and there will be memory loss. Patient won't remember much and there will be little bit of agitation and patient will be very sleepy, patient will be drowsy and dysphagia. So swallowing difficulty will be there. So remember this: memory loss and decreased conscious levels in thalamic stroke. Thank you.